Thank you, Suki. Bless you, so proud. After a successful insurance enrollment event in the Lower East Side, Apicha staff reported that residents who are not in primary care resisted enrolling as Apicha patients. "We do not want to go to Apicha," a man said. "I do not want to sit in a waiting room with men who dress like girls. I do not have HIV and I'm not gay." No doubt, homophobia drives this sentiment. Proudly, I say yes, Apicha is a clinic for gays, as it is for heterosexuals, transgenders, immigrants. We provide primary medical care, care management, mental health services, family planning, STI screenings, and many more. We have a pharmacy in-house where eligible patients can get discounted drugs. Our doors are open to anyone, regardless of their immigration status or ability to pay. Tonight's community service by the Japanese Mental Health Clinic affirms Apicha's history and commitment to the Lower East Side community and beyond. I am deeply honored to accept this award. Hamilton-Madison House in Apicha have worked together through Apicha's almost 30 years of existence. Hamilton-Madison was among the early supporters of our application to become the federally qualified health center. We provided Hamilton-Madison staff training on HIV and LGBT sensitivity. We serve on each other's client advisory boards and jointly marked events like Substance Use Disorder Awareness Month. Our commonalities abound. We both build programs and services vital to the community's needs. We serve immigrants. We reflect the diversity of the API communities in our programming. We take on highly stigmatized issues. Hamilton-Madison established pioneering mental health services for Asians, defying perceptions that mental health issues did not exist in API communities. Apicha sprang out of the AIDS movement, countering the notion that APIs didn't have the problem with HIV/AIDS. Creating programs like this is gutsy, sustaining them gutsier. I commend Isabel Cheng and Fumi Matsuki Rafe for keeping the lantern lit in the Japanese clinic. Indeed, the Japanese clinic is where our paths have crossed. It is a special resource to the Japanese American community, particularly for monolingual patients like one of Apicha's patients who suffer from serious depression following the sudden death of his mother. The suddenness of his mother's passing triggered harrowing memories of the staggering number of lives lost in an instant when the tsunami of 2011 hit Japan. Trauma could be caused by natural disaster or dislocation from home countries, hostility met as perpetual foreigners, the difficulty of generational integration into new society, family expectations of professional and financial success, and nowadays, facing ugly vitriol against people of color who come from poorer and conflict-ridden countries. Adults, seniors included, and young ones may suffer from mental illness. It takes all of us to grapple with these issues. Asians are 5 times less likely to seek mental health services than Caucasians do. Asians are known to present mental health illness to medical providers as physical illness such as headaches and stomach aches. Just like the stigma related to homosexuality and living with HIV, many suffer severe mental health illness due to lack of family understanding and support. To many, a mental health problem brings shame to family and friends. Our country's siloed healthcare delivery have not been helpful in improving those social conditions. But new, encouraging, transformative changes are afoot, including integration of physical and behavioral health services, co-location, or integrated workflows for different locations, introduction of telehealth technology, and increased awareness of mental health issues. Also, there's emphasis on patient-centered medical care, which requires taking care of mental health housing, nutrition, and other social conditions that affect the physical health of patients. We now have the unique opportunity to respond to the transformative stimuli flowing around us. Let us seize it. Apicha developed cultural competence in dealing with homophobia and related HIV discrimination. We believe health is not just the absence of illness, but a state of complete physical, mental, and social being. We also believe that silence does not just mean strength. It could also mean neglect, discrimination, loss of quality of life, and worse, death. Apicha is about building a healthy and empowered community. We all need to prioritize health and wellness in our community. As service providers, as well as advocates, our task is to create bridges, work closer together to take care of those who need coordinated and integrated care. In these dark times, there are good reasons to keep our hope alive. We know now that an HIV diagnosis is no longer a death sentence. Instead, we live in a time where you equals you. Undetectable equals untransmittable. It means that people living with HIV who take antiretroviral meds and maintain an undetectable viral load cannot transmit virus sexually. For people who are HIV negative, they can take an HIV prevention pill, like the pre-exposure prophylaxis. New York State pledged to end the epidemic by 2020, the federal government by 2030. Nature versus culture. We can only control so much. Culture, we can change. Apicha and Hamilton-Madison. To make human beings whole, we must be at the forefront of change. Our task is to make human beings whole. This is what I want to capture in the poem I've written for tonight. Tsunami 2011 hit Fukushima, 9.0 earthquake in magnitude. Hiroshima atomic bomb equal to 6.0. 30-foot wave bulldozed lives and livelihood. Swallowed 220,000 to their graveyard in the Pacific Ocean. Nature leveled a village. Ruined nuclear plant built, despite warning not to, a decade earlier, rendered a village inhabitable. USA, mass shootings, ammunitions of battle splintered in children's bodies, an epidemic, guns of hate and supremacy, seeking attention, getting none, background check, did not find mental illness. This is for children who were AR-15 and AK-47, wrapped in Second Amendment rights, bring deluge of prophets, politicians offer thoughts and prayers as we bury the slaughter. HIV/AIDS world epidemic claimed 32 million lives in the US, 700,000. An aggressive and constantly mutating virus attacking a human body's immune system spread through sex, drugs, mother's milk. A disease dismissed and ignored for many, many, many years. Tradition, religion, denial make it easy to hate homosexuals and drug users. Ignore women who were not supposed to get HIV. The virus is a deadly mutant of nature, stigma, a social disease. Human beings versus nature since time immemorial, but a hangman's knot, braided by ignorance, power imbalance, loathing, are made by humans, forceful as tsunamis, deadly as guns, devastating as HIV. We can change, to build, to thrive, to be one Asian American strong. Let's imagine a future together. Thank you.